Everything we do is based on MCG, and all of your questions and your assessments and your teaching materials. That's our foundation and our basis for doing anything. So we have used your social determinants of health questions in population health for a long time. It's not the exact question because, as I said, the doctors, we had to tweak the question in order for the clinics to be able to accept that this is something they could do. And I think that's what makes SHARP stand out, is that when we collaborate and work with our physicians and our clinic groups, we're not dogmatic. We say this is what we want to do, and we put together a guideline or a protocol of how we want to achieve it. But when we know we're going to reach barriers, and we know it's probably, well, now I know, it's probably not going to go the way you originally thought it was going to be, but we're willing to tweak our plans and change it up and negotiate on, like, what should the question say? Even though it's not the too standardized question, it's still screening patients and it's still getting them over to our department to get them help. More than 1 out of every 5 people living in San Diego experiences food insecurity. And for children, it's more than 1 out of 4. For people with disabilities, it's 1 out of 3 experience food insecurity. So we really thought that we needed to make it a goal to screen 100% of our patients that come and receive care at Sharp-Ries-Steele to see what our population look like. Are we equal to what the San Diego County data says? Probably we do a little bit better than that, but we don't even know. And when we started asking the questions, we couldn't believe we got about 2% of the people we asked the questions who really were suffering for some food insecurity. And those are people that maybe wouldn't have been helped if we hadn't screened for it. We parsed it out, and I think we got to over 5%. I think we got to 6% of the combined question. But if you just took out the data for food insecurity, we were up close to 20%. So right now we're over 20%, which is still far away from 100%. And it took us about 5 years to get here. But we're seeing growth, and we're seeing buy-in, and we're seeing it become standard of care. Once something becomes an entity goal, it gets more visibility. Well, we have the foundation, which is a part of SHARP that accepts donations from the community or patients, and they take that money and they make sure they serve the community back by using that money for some sort of better health outcome. And they saw what we were doing for food insecurity, and they were so impressed by the response that we've had and the help that we were able to give patients with our social workers, that they gave us $100,000 to be able to use in any way that we deemed appropriate to help people with food insecurity. So we got together, and our social workers are great, and we have 4 of them now, actually. And we got together to talk about how we want to use this money. And we determined that we wanted to give away grocery gift cards to 2 of the grocery stores in San Diego that are everywhere in $100 amounts. You get a grocery card for $100 to spend at the food store. And we put together an evaluation process that was pretty strict and done by our social workers to see what patients should get these $100 gift cards. And we didn't put any stipulations on it. If you were in need of food, you talked to a social worker and shared your experiences, and the social worker worked with you, you got a $100 gift card. We did not advertise it to the community, so the community and people outside of SHARP did not know about it. We just got referrals. The clinics knew about it, so they knew that if they had patients that really needed food, they would send them over, and we would screen everybody through our community health workers and our social workers. And we ended up giving out 700 unique $100 gift cards to 700 unique patients. And then another 200 people got more than one gift card because like some of them had like 5 or 6 kids and they needed formula and other things, not just food for the family, but food for the kids. And so it was the patients were blown away. Patients that didn't even know we did this. And then once they talked to our social worker, were offered this. They just loved it. And it was a huge deal and made all the clinics happy too. Because the doctor said, well, I can't believe this, that I could find out something and send it away. And then your team will take care of it and do something about it.